Right. Oh, okay. Yeah. No. Thank you. Thank you for the introduction. So we're just going to talk about our research, which is understanding personal shielding stories, the voice of people living with arthritis and musculoskeletal disease. And I've put up the details there. And what I just wanted to say is, thanks to our funder Versus Arthritis. So this was the New Opportunities Fund. It was a light touch application, and it had a limit of £50,000. It was for COVID-related research, and they offered a quick decision, but they were also, I knew that they were willing to consider patient-led research. So it was an ideal opportunity for our project. And if there's any funders in the room, then you might want to think of doing something similar. So what did we want to achieve? So we've kind of put this slide into two things. So our research aims, which was to capture the views and experiences of the shielding process, understand what people with arthritis think of the need to shield, benefits and risks. So this came from a conversation about could we text mine outpatient department letters for insights to help the identification of people that needed to shield. And we thought, okay, that sounds great, but how do we bring this data to life? How do we, and in order to do this, surely we need to understand what's important to people who need to shield, because much of the existing research was quantitative and crucially didn't involve patients. And it certainly didn't reflect the issues that I had with shielding and because I had to shield and talking to people in my networks, they felt the same. So if we wanted to improve the process of what was important to understand from people's shielding experiences, then we actually needed to talk to people living with arthritis who needed to shield. But also crucially, we wanted to capture the process of working together. So, and I think I was caught up in the beginning about this being patient-led research, and it isn't, because you'll hear from Charlotte, who's a rheumatologist, and the research is better for her involvement and for her coming on board to be our principal investigator. But we wanted to capture the process of working together, because we all have an interest in patient-public involvement as a subject in its own right, not just as a means to an end in rheumatology or other research. So I'm going to pass over to Joyce now to talk about our research funding success built in this. And I hope at the end you'll have some questions, because for the people that know me know that I can be a real critical friend. So this is now your opportunity to ask me difficult and challenging questions. And I'll pass on to Joyce.
So hello everyone, and thank you for this opportunity to present today. So we've reflected a lot on our journey so far with this research, and thinking about what the ingredients are that have come together to play a role in our journey so far. Asking what was it that led to an idea from patients becoming a funded research project. And in reflecting on our journey, we believe that the research funding success has been built on these three things: conversations, relationships, and collaborations. And it started from a conversation in a patient and public involvement group, which was supporting research about COVID-19. But that conversation was only really possible because the Centre for Epidemiology, or the CFE, is committed to involving patients in their research. So in the early stages of the pandemic, the CFE started research into COVID and rheumatology patients, and they were using data in patient electronic health records. So alongside this, they also committed to fund and support a PPI group to work with the research team. And it was in that group, that PPI group, that Lynn and I first met, because we're both members of it. So in one of the early meetings, the group was discussing a project that's text mining outpatient letters to improve the identification of people who need to shield, as Lynn has already said. And in the conversation, public contributors also discussed about what is important to people who were shielding, what were their experiences of shielding and the shielding process, and the fact that this would not be found in the outpatient letters. So the group felt it was important to hear directly from people about their experiences, as this would add a sort of a different dimension and a deeper understanding to that gained from the data alone. We wanted to bring the data to life. We wanted to understand people's experiences in order to add context to the data and to check assumptions. And then further conversations have led on to further research. And one of the researchers working on the initial text mining research, called Goran Nenadic, he's PI with Lynn as a co-investigator on a successful grant application to the Engineering and Physical Sciences Research Council for a project entitled Integrating Hospital Outpatient Letters into the Healthcare Data Space. And at this point, I'll hand over to Charlotte.
Thanks very much, both of you. So I'm a clinical rheumatologist and still in training, come to the end of my rheumatology training. And the bit of the kind of collaboration I'm going to talk about is the impact of the relationships and the broader collaboration that we have all formed in order to complete this work. So we all knew of each other or knew each other before we started working together. Joyce had helped co-develop some Choosing Wisely recommendations that I'd led a few years ago. Lynn and I met briefly at a conference and had interacted over Twitter, and Joyce and Lynn had already worked together. So those existing relationships were really important to help us all feel like we would be able to work together well as a team. We've also had fantastic support from the Centre for Epidemiology versus Arthritis at the University of Manchester, which is where we're based. Clearly, this work is not epidemiological, but the department is very in favour of involving patients and the public. And we've had fantastic support from the administrative team, the information governance team, and really brilliant senior leadership from Will Dixon, who heads the department, and Caroline Sanders, who's a professor with an expertise in patient and public involvement. And the timing of this is really quite serendipitous, as successes in academia often can be. I was just coming into the first year of my clinical lectureship, so it was a great opportunity for me to lead my first research project, and Lynn and Joyce were looking for an academic who would have the inclination and time to dedicate to working together with them. In terms of versus arthritis, Lynn has already talked a little bit about the application process, but it was a really short form, which meant that actually we started the process by them completing the form and putting their ideas down on paper. And I reviewed my sort of responsibility really to try to keep the essence of what they wanted to achieve through the grant, but also to present the application in a way that the funders would feel like this is a good research team, and that they would buy into us as a team, and that we would have the academic capability as well as the ideas and enthusiasm coming from Lynn and Joyce. And that seems to have worked well. It does take time to work together in this way, partly so sometimes I'm giving a training element in terms of what the expectation is of working with the academic field, and also, as I said before, really keen to keep the basis of what Lynn and Joyce want to do into the work. The funder have been really flexible, as you might imagine, and there are lots of subtleties involved with the payment and contracting of patient and public involvement, which is different to a kind of standard research fellow. That has meant we've had to liaise with the funder more frequently, and they have actually been really flexible about some of the offerings we're able to make. Some of them we're not, because of the kind of bureaucracy involved in universities and funders, but where possible, both the University of Manchester and the funder versus arthritis have really helped to support us all. In terms of how we work together, because I'm aware that Lynn and Joyce come as patient and public contributors, they will tell you about their own health issues if they want to, but obviously in their role as patients and members of the public, they have things that may interfere with their ability to perform the work. And also it's a more emotional piece of work for them in terms of their own experience of the pandemic and of shielding. So it was important to me to make sure that we talk about our feelings whenever we meet. So I always start with all of us asking each other how we are. And it's not a kind of flippant, polite thing. It can be quite an emotional conversation, and I've had to push myself to be more open about how I'm feeling in relation to this work and how we're working together as a team. Otherwise that wouldn't be an equal exchange. But I hope that that means that we have been able to develop a relationship that is honest, and where we can make allowances where things have been more difficult as we've gone forward. And as Lynn said, we're capturing the work that we're doing by talking to each other about it, and also through keeping a journal, and we hope to reflect on the process of working together once we come to the end. Can I have the next slide, please, Lynn? So I'm going to begin talking through some of the challenges of working together, because it's not all motherhood and apple pie. So for me, it's been an interesting and new experience to lead a grant, and that's been a great opportunity and something that I was going to need to do, working with patients and public as people who would otherwise have been employed researchers just does add another level of complexity to that relationship. So I think it makes working with Lynn and Joyce a more emotional task, as I talked about before, which is really fantastically enjoyable, but sometimes can be stressful. And the bureaucracy around contracts, as Lynn and Joyce will, I'm sure, talk about, has meant that there was a huge amount more administrative burden on me to get the systems kind of up and running with help from the admin team. And then needing to be very careful about access to data and making sure that everybody's got all the right permissions. So I will hand back to Lynn to talk about her experiences of the challenges. Thank you.
Yeah. Thanks, Charlotte. I mean, I think there was Joyce and myself put in a huge amount of work pre-award, just, you know, talking to each other about the research, going out into our networks to talk to people, and that is never funded. And I think that's a real issue going forward with patient public involvement and with any patient-led research. And for me, it's been a huge imposter syndrome. You know, I'm not a researcher, I'm not an academic. So trying to overcome that, and especially my IT difficulties, have been a bit of a nightmare. Joyce, do you have any reflections?
Yeah, so during the period that we've been working together, I've had difficulties with my health, I've had flares in my condition, and at times they've really impacted on the work that I can do and the way I can think or actually not think. So I felt the weight of that quite heavy, because I feel a real responsibility to do this and to do it well. And the experiences I've had with my health have meant that I've been working a lot more slowly, so the two don't really fit together very well. But I've had incredible support from both Charlotte and Lynn on that, so it's been a fantastic team. I think another difficulty is very much around arranging the type of contract that would work for both the university and their requirements, and also those of a public contributor who isn't necessarily looking to become an employee, but understands the requirements of the university, but wants to protect their sort of scenario as a public contributor, rather than stepping into the arena of being an employee by an organisation again. So there've been other challenges too, but I think those are probably two of the main ones that I've experienced.
So we just want to say thank you for your interest and for the invite. And I forgot to say I'm a lay member, or did I say I'm a lay member of the Data Science Centre? So this is how I know Kathy and got involved in this. So I will stop sharing, hopefully.